Good morning, everyone. My name is Beth, and I am here with my coworker, Sally, and we are with the Education Alliance. At the Education Alliance, our mission is to bring businesses and communities together to support public schools, and we are passionate about helping students explore career opportunities and develop skills that they need for future success. And one of the ways that we do that is through programs like this. This is our virtual work-based learning program, and we connect students with industry professionals to gain real-world insights and experiences. Today, I am excited that we have WVU Medicine with us, giving you a firsthand look at the careers in this field. So without further ado, I'd like to introduce Jessica Hall from WVU Medicine.
Thank you, Beth. Hello, students. My name is Jessica Hall. I'm the Manager of Talent Acquisition for WVU Medicine. Thank you, Beth and Sally, for inviting me to speak today about WVU Medicine and our careers and everything we have going on with thousands of positions that we're hiring each year. So with that, I'll get started. Can you see my screen okay? Okay. And today I'm going to talk to you a little bit about WVU Medicine. I'm going to talk to you about the total rewards package that you get if you're an employee with us, some key jobs, and I'll even go over our application process and give you a high-level overview of what that looks like and how you can apply for a position if you're ever interested in working for WVU Medicine. I'll also try to leave some time at the end for questions. So first off, WVU Medicine, I like to start with our mission because our mission is to improve the health of West Virginians and all we serve through excellence in patient care, research, and education, which is a big part of why we partner with the Education Alliance. And we do programs like our created MedEd with Mon County Schools and Jefferson County Schools. And anything we can do to really support education and also growing our own, building employees that can be trained as early as high school and come right out of high school ready to work and hopefully have a long career with WVU Medicine. So a little bit about WVU Medicine. WVU Medicine is a health system, and it spans throughout the state of West Virginia and our neighboring states, including Pennsylvania, Virginia, and Maryland, and Ohio. So I have a map up there that shows you some of our system hospitals. We are up to 25 hospitals and growing in our health system. And our largest hospital in our health system is located here in Morgantown, West Virginia. It's J.W. Ruby Memorial Hospital. It's what we call the flagship hospital or the largest hospital in the health system. In a company in another industry, we might refer to that as corporate, if you will, but it's where a lot of our administration is housed, and it has the most beds of any of the hospitals by far in the health system. How many of you have heard of Ruby Memorial Hospital or maybe visited a WVU Medicine hospital? Okay, yes, I see some hands there. Very good, very good. All right, now this is a virtual tour of WVU Medicine, but because this video isn't working, I can just kind of show you here. We'll go back into the map. So where I'm located right now is in Morgantown, West Virginia, here in Monongalia County, and that is where J.W. Ruby Memorial Hospital is located, the largest hospital in the health system. But we have hospitals all over that range in different areas, and you see them here. And they go throughout the state and our neighboring states. Now, with that, we also have hundreds of clinics. So if you're driving through West Virginia, you've probably noticed some WVU Medicine signage. You may have even gone to a WVU Medicine clinic before and thought, well, this isn't a hospital. And that's because it is, our health system is comprised of 25 hospitals and hundreds of clinics throughout the state. So a little bit by the numbers. So these are 2022 numbers that were pulled off of our our finance report, and our newest numbers should be coming out soon. And so with that, then we're always looking back a year at our research and data. So with that, you see that in 2022, we only had 17 hospitals and 2 managed, and we're already up to 25. So that really sets the pace on how we're growing. There is so much growth going on with WVU Medicine. As we continue to take over hospitals in the state, what that's in doing is ensuring that in communities that are oftentimes lesser served, maybe would have the difficulty to getting to the type of quality care that they need. A lot of times they would have to travel maybe for hours to get to a hospital where they could get the care that they need. And by taking over some of these community hospitals, we're able to ensure that those hospitals that maybe aren't big money makers, that they're able to stay open and be a point of access for the patients that live in those regions so that they can get access to care when they need it most. Now, WVU Medicine does a lot of business, a lot of stuff going on. If you've ever been in Ruby Memorial Hospital, there's a lot going on at any given day. At any given day throughout our health system, we have 3.8 million clinic visits. And then it lists there some of the other stats that are pretty impressive about our hospital outpatient visits, licensed beds, our ED visits, births, almost 7,000 births in any given day, and discharges. So a lot going on. Also, as far as patient reach, I think this is pretty cool stats as well. We actually have patients that come to us from all 50 states and Washington, D.C. A lot of people don't realize that. If you live here or you've grown up in this area, you may not realize what a phenomenal health system WVU Medicine is, that it actually does see patients and is very far reaching. We've also included a lot of other countries where we've had patients, which are listed there as well. All right, now some things that we're proud of. Leading the state and the nation, we are the largest hospital in our health system. We're also the largest hospital in our state. We're also nationally ranked #1 in adult specialty and #2 in children's specialties. And so some of the awards that we've received, once again, speaking to the level of care that you can get at WVU Medicine and the reason why it is recognized throughout the nation. All right, so a little bit more about JW Ruby Memorial. So as you remember, back when I was on the map screen, JW Ruby Memorial is located in Morgantown, West Virginia. It's the largest hospital in the health system. There's a picture of it there, if any of you have driven by it or been to it. So some things that you might find interesting about it. It is an academic medical center. So what does that mean? It means that we're partnered closely with WVU School of Medicine and other schools where we are constantly training people in different levels and different positions. So if you would visit JW Ruby Memorial Hospital today, you would likely run into some high school students that are there rounding and learning in clinical environments about some of our jobs. You would likely run into some nurse students that are not nurses yet. They're in nursing school and they're working alongside our trained nurses as they're learning to become nurses. You'd also likely run into some physicians that have residents with them and fellows with them. Residents and fellows who are in training. So they are actually doing their schooling on site in the clinic environment and developing. So that partnership with education really makes it for a great place to get care and also a great place to work. We're constantly looking for the best and the brightest in each one of the fields and growing in those niche markets to make sure that our doctors know the most about what's going on in each one of those fields. For example, would be the RNI, the our Neuro Institute, Rockefeller Neuro Institute. Maybe some of you have seen it was a 60 minutes. It was a 60 minutes interview that was done here recently about our Rockefeller Neuro Institute and some of the work that we're doing currently on Alzheimer's and dementia. Would any of you happen to have seen that by chance? No? Okay. Well, it is really exciting when you are able to watch a show like 60 Minutes and you see them spotlighting work and research that's being done at WVU Medicine right here in West Virginia. And it's leading science that is happening. They're doing things for the first in the world with regard to Alzheimer's and dementia. And we're also building a new cancer institute, which that just got announced this year. And so really exciting things as we're trying to continue to increase the level of and quality of care that patients can have. Our magnet certification. We are the only hospital certified with magnet certification in West Virginia. There's less than 500 nationwide. And matter of fact, our magnet surveyors come every 5 years to survey our hospitals, and they're actually on site today. They're here today on Monday, Tuesday, and Wednesday, and they're surveying our hospital and our health system to see if we can get renewed again for that magnet certification that we have been so proud over. And what that signifies is that we have a lower number of nurse turnover, but also increased engagement from our employee population, and that we're doing things not only excuse me, I sneeze there. Not only are we doing things for our patients that you maybe couldn't get in other places, but we're also doing things for our employees and for our nurses. We're partnering with the community and with programs such as Education Alliance today. And these things set us above and enable us to have things like the magnet certification that we're very proud of. We also just opened a children's hospital. It opened in 2022. Not sure if any of you have seen it, but if you drive by at night, it is beautiful because it's lit up in all these different colors. And it is something that we're really proud of. It was $150 million investment. It is a self-leaning hospital, which means that it is attached to Ruby Memorial Hospital, but it has its own entrance, its own ED, and its own pharmacy, its own cafeteria, and its own set of employees. We do have shared employees as well that go back and forth between Children's and Ruby, and we work very closely with them. But it's already been recognized for several awards, which I have listed there as well. So, okay, a little bit about our benefits. So if you're interested, or if you ever think you might be interested in working for WVU Medicine, it is a phenomenal employer. It is the largest private employer in West Virginia, only behind the state itself. The state hires is the largest employer in our state, our government. And then behind that, so the first or the largest private employer is WVU Medicine. We were second to Walmart for years and years. And then last year we took them over. So we are the largest employer. And our full-time employees, and even in part-time status, there are some benefits available, but our full-time employees enjoy a lot of benefits that make us an employer of choice. We have work-life harmony, as we like to call it, and what we allude to there is that we do offer a generous PTO package, where you're able to get paid time off that you accrue with every paycheck, so that every 2 weeks you're accruing PTO that then you can take as paid time off, as well as paid holidays. Additionally, we offer tuition assistance up to $3,000 annually. And that's for you or any of your dependents. So if you have children, that's something that you might be interested in as well. Also, after 5 years of employment with WVU Medicine, you or any of your dependents can attend WVU free of tuition, which is a huge cost savings for anyone that is planning to continue their education or have children that are going to be going to college. For retirement savings, we offer a 403B retirement savings where you are putting in a certain amount of your paycheck into a 403B account, and then the company is matching it up to 4.5%. Also, our full benefit plan offers you medical, dental, and vision. Our medical is through Peak Health, and then we also offer separate dental and vision plans. And then our compensation have there that it's market researched. And what we mean by that is that we do competitive compensation analysis that is not just for our region, but we look at our roles across multiple industries, not just healthcare, and throughout the entire nation, not just in our region. And then we ensure that our offers or our rates are above the 50th percentile of that. So what that means is that our offers or our roles that we have here at WVU Medicine should be competitive and paid at a competitive level across the nation. And that's a really good thing considering that West Virginia has a lower cost of living than some places.
So, Jess, I think this would be a good time to maybe stop and see if anyone has any questions. You've given us so much information.
Absolutely.
And especially because you're starting on the career portion of it. So I just wanted to give us all a moment to see if anyone has any questions.
Do you guys have any questions yet? Okay, I have a question.
Yes.
Can they hear me? Can you hear?
I
Yes.
can.
Okay, so like what jobs right now are in like the highest demand for the hospital?
Well, we have open over 1,000 jobs just at Ruby Memorial Hospital alone. And they range from all types, which that's something that I actually am going to go over here in a couple slides, but they range from all different types of levels. So we have positions open for housekeeping positions. That's always in demand. Nutrition, that in nutrition, we're talking about our cooks and our dietary assistants and dietetic specialists, our baristas that are making coffee at the hospital. Up through, we have clinical positions that are always open, like a radiology tech or an ultrasound tech. These are roles that are specializing in, they have that licensed field and they're licensed in their field. Also nurses, we always have nurse positions open, and it ranges up even to having provider positions open or physician positions open. So a whole range of positions open, over 1,000. And I actually will show you today how you can browse our career site at any time to look at all the positions we have open and how you can see what the minimum qualifications are and even set up alerts. Great question.
So I had like a follow-up question.
Yes.
The positions, like even if you're like a barista or like you're doing housekeeping or something, is it the same kind of benefits that you would get if you were working like as a nurse and stuff?
Yes, it is.
Okay.
Great question. And yes, it is. As a WVU Medicine employee, you receive our benefit package. And so that is the reason why we have employees that will work in our housekeeping department or in our nutrition department for over 30 years and retire from WVU Medicine.
I think Sally has a question. Go ahead, Sally.
Hey, Jessica, thank you. It's great information about a wonderful employer in our state. So I didn't know a lot of that. I'm curious, coming from a high school perspective, does the hospital offer any shadowing or internships? Because sometimes you may think you're interested in healthcare, but you're not sure which pathway would be an opportunity. And I'm thinking more like in the clinical patient areas.
Yes, we do. We have some formalized programs, one of which we've created called MedEd. It's in Mon County schools, part and Jefferson County schools, specifically in Mon County, partnered with University High School and Morgantown High School. And it's for that exact reason. It gives high school students, juniors and seniors, an opportunity to come to the hospital during their school day and round in certain departments that include sterile processing tech, ambulatory care tech, and phlebotomist in our labs. So they're able to get that up close and personal training and job shadowing. And then if they continue to be interested in their senior year, they actually get the opportunity for a paid internship. So the spring semester of their senior year, they're actually paid for the time that they're there. Then when they graduate from high school, they actually will qualify because of that experience and training. They would qualify for any of those three roles. Now, outside of that program, and we do have partnerships with MTech as well that provide internships on site. Outside of that, if you're a student and you're not involved in any of those things, you can come to the hospital and visit our volunteer services. In our volunteer services, you can request to job shadow any department, and they'll have you fill out some forms about confidentiality and safety and those type of things. And then they'll allow you to go with a representative from that department to learn more about the jobs and what that looks like behind the scene. And so then in that way, you're able to have an informal way of seeing what that job entails. But yes, that's been a big area of our focus, is building programs that give that level of exposure early on. It's a great question.
I think we have one more question.
Yes.
I was wondering, what do you guys think the most difficult part of working in the medical field is?
Well, that's a good question. And I would say that there's several different things. When you work in the healthcare industry, the standards are higher than you would see in other industries. And the reason is that it's often, impacting someone's life or their well-being in a direct or indirect way. I work in human resources. I'm not working on a patient. My hands are never on a patient, but the work I'm doing is impacting the level of care that patients can get. People who live right here in West Virginia. And so that calls me to a higher level of service. And it calls all of us to have a higher level of performance and commitment than you might have in another industry. With that being said, that's also a passion of mine, and I think a passion of a lot of my colleagues, and the reason that we choose to work in healthcare versus another industry. Also, if you're walking through the hospital on any given day, it's your workplace. It's where you work and you're very used to it, but you're walking alongside people who maybe are having the worst day of their life. Maybe just lost a loved one, maybe just got a diagnosis for a deadly disease, or they could be having the best day of their life and just had a new grandbaby born, that type of a thing. So it calls us to a higher level of empathy than you might have or need in another industry, where you have to realize that these are patients and not get to a place where it just becomes accustomed to you, but where you are still very much aware of your surroundings and the people and what they're experiencing and what they're going through. So it's not for everybody. It's not for everybody, but for the people that it is for, it becomes a passion. I did human resources in oil and gas and insurance for years and years before I came to WVU Medicine. And I've been with WVU Medicine now for 8 years. And I will tell you that I have definitely found my passion, because working in human resources and doing my job is something that I loved. But in other industries, it was really just all about making that company profitable. And with WVU Medicine, I get to do what I love, but I'm doing it to better the quality of care for people, that live here, including my family, relatives, friends, to be able to ensure that we have great quality care, and that there's people working at the hospital that want to be there and are at the best quality. And so that my two passions meet in that place, and that's why I stay at WVU Medicine. Great question. What other questions do we have?
Just to follow up with her question, like what, because you were talking about your experience, like what personality traits do you think would make a person like better fit for the job, like having more empathy,
Yes, definitely empathy. Empathy is going to be important regardless of the role. The unique thing about WVU Medicine is that, like I said earlier, we have over 1,000 positions open at any given time. So those positions span different types of roles. And so those different types of roles require different types of personalities. An example would be, we have an IT department. And so in IT, you have to be very detail oriented. You might be at a computer or a set of computers all day long and not really even talk to somebody face to face, but you're very detail oriented, getting in there and problem solving all day long. That requires a certain skill set. Now, with that, you may also have somebody in our hospital that is a radiology tech. A radiology tech works with patients, literally helping the patient get on the table, taking the x-rays of the patient, taking reading, working alongside the radiologist to read the past files, find out what's going on with the patient. And so that person also needs a great attention to detail, but they also would require a level of friendliness, or what we call bedside manner, where you are able to work with the patient and make them feel comfortable and maybe put them at ease. That's a very important trait with nursing, of course. And so it really depends on the type of position. But with all positions, things that are very important that go across the board are what we call the 3 C's, which are compassion, or that empathy, right? You have to have, even in IT, when you're working on a project and somebody comes to you and says, hey, I need a new computer, and you know that this computer is going to impact a patient being able to be seen, it takes that level of empathy regardless of what department you're in. So compassion is the first C. We also have commitment. Like I talked about, a higher level of dedication than you might have at other companies, because we're talking about people's life and death and wellness. And then the third C is competence, because we always need to be learning and growing in our role and making sure that we are the best of the best in what we do. So a lot to consider there, I know. Any other questions? Okay, well, I'll talk to you a little bit more about our benefits, and I want to also play a career anthems, which kind of goes right along with what we just talked about on a lot of those questions. So it's pretty cool. You'll get to see it out of somebody's mouth. But before I do, I just wanted to touch base on this slide here. So continuing education assistance is something we're really proud of, and we enable people to start. What we like to say is, where you start isn't necessarily where you'll end up. So coming out of school, you may not qualify for all the jobs. You're not going to qualify for all the jobs we have open. But where you start doesn't have to be where you end up at WVU Medicine. You could start in a role And you may love that role and continue to develop in that role. You might also, while you're with us, be continuing your education using our education assistants, and then being promoted up through that department or change jobs. I actually just talked to an IT specialist, one of our IT specialists that has been with us for years and years, and started his role as a surge tech. And so he was a surge tech for a while, and that's a huge change. But as he was working as a surge tech, which is what he always thought he wanted to do, he got out of school, became a surge tech, and he did it and he liked it, but he got exposure to IT and he was like, wow, I think I really have a lot of interest in that. And that's the nice thing at WVU Medicine. You're working alongside people in other departments. And he got some mentorship from some people in IT and said, you know what? I think I might continue my education while working as a surge tech. He continued his education and then was able to move into our IT department where he lived out that dream of the job that he found that he really wanted to be at. So it's important to remember where you start isn't always where you end. And that is a perk of working for WVU Medicine is we are so large that we can support that career pathing, and we help you with that, with things like education assistance, but also with mentorship and being able to work alongside people who love what they do. And so you get exposure to these jobs in a way that you wouldn't if you worked in another industry that didn't span so many job roles. So now let me play this career anthems. What I'm going to do here is pause the slideshow and pull it up on YouTube. There it is. Okay. You're going to see that it covers some of the themes we just talked about. I really love this one particularly. We have lots of YouTube videos. If you ever want to take a look at our site, our WVU Medicine site on YouTube, it covers not only a lot of the reasons it's great to work at WVU Medicine, it covers some of our programs I was talking about, like Med Ed. It also covers just we do some spotlights on different jobs. So another way to Sally's question earlier about what's another way that students can learn more about different jobs and different career paths at the hospital, we do have some that are spotlighted on our YouTube channel. So check it out sometime. But here I will play this.
There are a lot of health challenges in West Virginia. If we are going to change the health trajectory of the state of West Virginia, we can't do what we've always done. But we have to attract the best and the brightest. We have to attract people with a little fire in their belly to make a difference.
I wanted to be a pharmacist, wanted to work at WVU Medicine because I really felt like I was having a direct hand in helping people who are very sick in the hospital get better.
I work here. I think patient care is in my blood. It's not just cleaning the rooms, it's helping people get better.
Food is another type of medicine to these patients. They need the nutrients from the food in order to get better, in order to be able to go home.
When I was much younger, I wanted to be a nurse until I realized I couldn't stand the sight of blood. I get to take care of patients. I just do it from a different perspective. I'm delivering technology that takes care of those patients.
In 1982, a neonatal transport team saved my life. Here I am 37 years later, and that's why I do what I do, to give those parents hope. If you have engaged and spirited employees that love what they do, patients are going to feel that. We're going to become a role model for healthcare entities around the country right here in West Virginia.
We're leading the market by offering benefits that are not typical in healthcare. So it's important to make sure that we're doing what we need to do to support all of our employees across WVU Medicine so they can focus on our patients and providing excellent patient care day in and day out.
They made an investment not only in myself, but they made an investment in my children's future as well. For 3 kids of my own, I don't have to worry about it. They're going to be mountaineers.
It makes me want to go forward with my career, especially in healthcare, because I know they have my back.
Here is an opportunity to be a part of a world-class health system
with everything from an 800-bed academic medical center in Morgantown to 25-bed critical access hospitals in rural communities. There truly is something for everyone here.
In order to help our patients, we needed to branch out. We're taking care of the whole state of West Virginia and beyond, and we're able to see more patients and get more patients the care they deserve.
Every day you come to work, it's something new, whether that be through Alzheimer's research, organ transplants. WVU Medicine is going places.
Everybody smiles and says, hey, and it's genuine. I appreciate that. It makes my job easier because if everybody cares what to do, it makes me excited about what I'm doing. That I'm contributing something that's bigger than me.
There's a lot of people coming from different places, from different cultures. They all come here and we all have the same goal to take care of people.
We all have one common mission here. Even though we're all part of one big team, every one of our employees can make a difference in the lives of those they touch. Here at WVU Medicine, we call this the power of me.
Whether you work in housekeeping, in the cafeteria, you're a physician, you're a pharmacist, you have an active hand at WVU Medicine in helping our state get better and be healthy. I don't know why a provider would want to work anywhere else.
All right.
It's a really great video.
Thank you, Beth.
I love how it shows just the dimensions of the variety of careers within just the medical field. And it seems like WVU Medicine really highlights everyone that works for them.
Thank you. That truly is the goal. Right. I will switch back to my PowerPoint now. So on that note, so I wanted to highlight some of the immediate needs that require a high school diploma. So when I show you how to go onto our career site and how to search, you may come up with lots of jobs and some of which you don't qualify for. And I'll show you how to tell. But that can be a little bit overwhelming. And you can say, you know, what jobs do I qualify for? And so I listed some of them here. And the important thing to remember is that, which I touched on this already, but where you start isn't always necessarily where you end up. So having an interest and an open mind in the type of position that you work for to get your foot in the door is often a very good strategy as you grow and learn throughout your career, regardless of what employer you work for, but certainly for WVU Medicine. Now, some things I wanted to highlight. We do have a Facebook and Instagram page for WVU Medicine where we post a lot of jobs that we are looking for applicants, also career events that we do. We'll do in-person events and virtual hiring events. And with virtual hiring events, you just log on from your computer and you speak live with a recruiter and you do the interview. You have your camera on like we do today, and you do the interview virtually. And we do those almost every single week. And so we have them focusing on different positions in different departments that need applicants. So if you are in the job market, you are interested in seeing what we have to offer, it's a great thing to just follow us on these social media platforms because we try to do a good job of keeping you updated. Also, LinkedIn is another one, of course. All right, so to apply, what it's going to look like is you're going to go to our WVU Medicine Careers website. It's going to pop up and look like this. I don't know. All right. So it's going to look like this. And this is the site right here. If you want to take a picture of that with your phone or write that down. All right. Now, this is what the site will look like, and you're going to see two options, WVU Medicine careers, or of course, our faculty, physician, and providers. These are for roles here separately that, are for our physicians. So you will want to select WVU Medicine careers. But you can always select the other one just to see what's out there and just to kind of research. I think it's good for an educational purpose. But if you're job hunting, you're going to want to click WVU Medicine Careers. Once you do that, it's going to come up to a search bar. Now, in the search bar, you can use our keyword search to enter there a job. If you saw a job today that we talked about that you'd like to take a look at, like barista was mentioned, you want to put barista in there. That'll pull up a search of all of our barista positions open. And with that, the keyword search is nice because it'll also pull up other jobs that may be close or similar to and have that in the job description. So for instance, if you're like, I could really do anything that is, nutrition related, and you put nutrition in there or food, it'll pull up some results for you. With that, there's some other key filters that you want to pay attention to. There's one that's location, and that's important because WVU Medicine, again, we span throughout the state and our neighboring states. So you're going to want to tailor that to your location and to where you're interested in working. And then it will tailor that search for those reasons. Time type, that means full-time, part-time, or casual. Full-time, you're talking about anything above a 0.9 FTE. So anything above 32 hours in a week. Now, for part-time, it's anything that is around 20 hours in a week. Okay, so you're working part-time. Or there's casual. Casual could be like 1 day a week. We have PRN roles where that's on an as needed basis. So you'll want to look through that, and you can select that time type. We do have a variety of shifts available in a lot of different roles, and that's another way that we support education and partnering with education, because it allows our employees to continue their education. It allows our employees to go to school on the nights, the weekends, or even maybe the days, and then they work on the evenings or the nights or the weekends. And so by offering that variety of shifts, it's another way that we're supporting you in your educational endeavors. Also company, you're going to see company there, which can be a little confusing, but remember, it's about all of those hospitals because we have so many hospitals in our health system. And so you can just use those to tailor down your search. Once you do that, so let's say I'm searching for an ambassador. And I might just want to know, a little bit more about the ambassador role. I might be interested in to apply. So I put that there. I search it. It comes up with one. This one was posted just 15 days ago in the Children's Hospital. And so then it pops up with the role. Now it has a big apply button, so you can select on that, and that's going to open you up and ask you to start an account with us if you don't already have one, and just uses your email, and then you put in your name and your address, your contact information. You can upload a resume, so then it makes it easy. You don't have to input all of your education or previous employers. You just upload that resume, and then you can use that account for any applying you do in the future. And it even sends you alerts. You can set up search alerts in your account. If there's a particular job you're wanting to see when it comes open, and it'll email you when it comes available. It'll also alert you anytime one of your applications changes in status. So let's say your application goes from being reviewed by a recruiter to being reviewed by a manager, or scheduling an interview. You'll receive an alert through email about that too. So it's a great way to stay connected through your job search with us. Now, also, you're going to see that if you scroll down here in this job, in the body of the job, you're going to have the job description. And that's important too, because, learning about these roles and what they entail, a lot of times you might not have the exposure to those jobs. And so this is another great way to do your homework in advance and peruse our site. Take a look at different jobs we have open and read the job descriptions. Read what the job does, what it entails, but also what the requirements are. The minimum requirements are what you have to have in order to be qualified to do the job. The level of experience or the level of education will be listed there. So let me just pull that up on an actual search so you can see that live. So I go to the career site. Again, I search WVU Medicine careers. Since we talked about barista, let's see if we have a barista open. We have some, but remember, the location is important. Right now, I have the location on everywhere. So I need to be cognizant of that. If I live here in Morgantown and I want to work in Morgantown. So it's going to list all the locations. This one's in Wheeling. This one right here is at the Rockefeller Neuro Institute that we spoke about, that's doing that Alzheimer's research. This one here is at Ruby Memorial Hospital here in Morgantown. So I'm going to click on this one. And it's going to tell me more about the role. Again, it's going to tell me where it's located. Ruby Memorial Hospital, that's what we wanted. This is a full-time role. Tells me how long it's been open. And then I can scroll down. This welcomes me to the site. This talks a little bit, this is a short summary about the role. So this one's telling me that it provides excellent service and expertly crafted products. You work in an energetic store environment where you have the ability to master your food and beverage craft and work alongside friends and meet new people every day. So then we hone in on the minimum qualifications. So you're going to see minimum qualifications and preferred qualifications. The difference is minimum qualifications are required. You have to have those in order to work the job. If you don't have these qualifications, then you don't qualify for the role. Whereas preferred qualifications are what they're really looking for above and beyond the qualification, what, an ideal candidate would look like. So if I hone in on the minimum qualifications for the role, this requires a valid food service work permit from Monongalia County prior to starting, or obtain an MCHD temporary worker permit no later than the first Wednesday of employment. Until a temporary one is obtained, you may handle food exposed. So that's saying that if I don't have that permit, that I have time to get it before I would start. So, okay, that means I so far I still qualify. And then the number 2 thing is Starbucks Barista Basic Certification within the first 90 days of hire. So based on that, you should be qualified. Each of you in there right now should be qualified for this job based on these minimum qualifications. So this is a role that you could go in and you could apply for. And like I said, we have hundreds, we have actually over 1,000 roles open. I can see here. Yeah, over 2,000 jobs found. So we have a lot to go through, but I welcome you to get on that site, peruse that site, and learn about our careers. It's a great place to learn. It also has an about us if you want to learn more about our brand. And then I want to pull up my information one more time. Again, my name is Jessica Hall. I'm the manager of talent acquisition, and you can reach out to me anytime with questions, follow-ups from today. I'd be happy to meet with you, answer any questions you might have, or talk to you more about employment with WVU Medicine. Here, I have my email address here. Let me go back to sharing this. There you go. So you can take a picture of that if you'd like. Any other questions that I can answer today?
Is there anything else that you guys want?
I have a question.
Okay, go ahead.
What would you say makes the WVU medicine system like different from other health systems across the U.S.?
Okay. Great question. Well, one thing that I think separates us from everybody else in the nation is that we here in West Virginia have a high poverty rate in our state. So our state has a lot of very sick people that don't have the means to travel, miles and miles away to go get the care that they may need, due to the poverty that we have in our state. We also have, as many of you are probably aware, we also have a drug epidemic problem in the state of West Virginia, with fentanyl and other drugs that has hit hard in our state, particularly like in Harrison County. Clarksburg is rated one of the worst, also in some of our southern counties. And so in these ways, WVU Medicine has some big responsibilities right here on the home front to care for patients that are often very sick and come to us with pre-existing conditions. They may not have seen the doctor as much as other people would have throughout the course of their life because they may be living in poverty. They may have not had the access to see that. And so for that reason, they wouldn't be as easy to get up to that standard of health as another patient would. And so for that reason, WVU Medicine is special in that way because we care very much about making the place, this state, and everywhere that we are located have the best quality of care and, really bettering that community. Another way I think that we separate ourselves out would be things like this. Things like what I'm doing today, partnering with the community. So it's not just about taking on doctor's visits or seeing patients, but it's also about furthering research and education and partnering with the community and with educational partners, students, and such to make sure that the community is aware of WVU Medicine and what we're doing here and what opportunities exist for you to help and for you to get involved. And I think that definitely sets us apart as well. Great question. What other questions?
Do you guys have any others? Okay, go ahead.
What is like a typical workday in your life look like?
I'm sorry?
What's like a typical workday in your life look like?
Okay, a typical workday of my life. So I'm the manager of talent acquisition. So my job is I manage a team of recruiters. I have 13 recruiters that report to me. They actually, some of them live here in West Virginia and they will come in and work in the hospital. I even have one that lives in Texas, one that lives in Illinois. So I have recruiters all over that are working to fill open positions. So a day in my life looks different every day, but I like that. And I think that every personality is a little different. Some people would hate that, but I love it. I love the ability that every single day looks different. So I might start my day like today with a couple meetings, meeting with some of my team, meeting with some of my recruiters, talking through some strategies on filling some hard to fill openings. Then I might have a presentation that I give to a classroom. Then after that, I may have some meetings with some departments talking about a strategy for opening a new cancer center or opening a new department and what that looks like as far as building out a workforce development plan to make sure that we're going to be fully staffed. And then in the afternoon, I might go to one of our high schools where we have our med ed partnership and check on our students there and check with the instructors and see how that partnership is going, or go in and complete an interview for one of the positions that I have open on my team that I'm looking to fill. So every day looks different. I'm in the hospital, I'm in the schools, I work remotely, I do some travel, not as much travel as I used to do as a recruiter. A recruiter does more travel than in my current role, but every day looks a little bit different. Great question.
Got some really great questions today and some really great discussions. Are there any more questions?
No, I think we're good.
Okay.
Thank you so much.
Yes, thank you. Thank you all for joining us today. We hope that this session has given you some valuable insight to WVU Medicine and the different careers that you can have within WVU Medicine or the medical field. Just a quick reminder that our work-based learning modules happen every Monday, and you can watch all of those modules. We upload all of them. They are housed on our YouTube page, and that can be accessed through educationalliance.org/work-based learning. So we encourage you to keep exploring, keep asking questions, and thanks again. And we look forward to talking to you next time.
Thank you.